Good morning. It's my great pleasure to be here. So I'm going to talk about surveillance of HPV in France. Basically, HPV surveillance in France is dedicated to the National Reference Center, which is now hosted by the University Hospital of Besançon since 2017. And this National Reference Center, or National Reference Laboratory, was appointed by the French Ministry of Health. And it was done a couple of years before 2017 in the context of introducing HPV vaccination in France and introducing new strategies for cervical cancer screening. And it was hosted by the Pasteur Institute. But why Besançon? Let me give you a historical view. In Besançon, we work on HPV since more than 25 years. And we started with colleagues, dermatologists and gynecologists, and my boss, Christiane Mougin, and all of these people were interested in HPV. And during the last 20 years, we used to work on HPV, both in a research team here and in a routine way for HPV testing for cervical cancer screening. And we start, as you can see here, with different approaches to analyze HPV. Electron microscopy, it was a long time ago, but we had this competence, followed by in situ hybridization, then PCR, which was developed, for example, here, PCR with MYL and MYL11 sequences, and real-time PCR for quantification, and now we are developing new generation sequencing. And other important point is that Christiane Mougin participated in 2004 in the discussion for the reimbursement of HPV testing in France following the NSCUS cytology for triage of women. Here you are the team. As Kate said, I'm at the head of the National Reference Laboratory, and I work with two assistant professors, one in cellular biology, the other one in virology, and we also have the experience of a hospital practitioner, and we have a technician and engineer who help us to conduct the studies. Of course, Christiane Mougin, who is a professor emeritus, helped us in these different tasks, and we also work in coordination with Anne-Sophie Voronoff from the Cancer Registry, and Jean-Jacques Baldauf, who was a professor of gynecology in Strasbourg, and who has a great experience in HPV in cervical cancer screening. Of course, we have a networking in France, as well as at the international level, which permits us to conduct and to propose studies to study HPV. Here, a map of France in the left, with different university lab, university hospital lab, general hospital lab, private lab, pathology lab, gynecologists. And in coordination with Professor Joachim Dillner, we have created a consortium of national HPV reference laboratories, which are here for the moment. We actually distributed all over the world. So the National Reference Center has 4 missions. The first mission is expertise regarding HPV primary screening for cervical cancer right now, but also for vaccination. And regarding HPV testing, we have to produce a list of validated kits for cervical cancer screening. Of course, the National Reference Center cannot test all the tests which are available, and there are a very nice consortium in the world who do so, for example, through Valgen studies. But we have to provide a list of validated kits for the different laboratory who wants to introduce HPV testing in their routine. We also have a work on cell collection media, which is very important to preserve cells for screening, and we also work on self-sampling devices. We run different techniques for HPV characterization in the reference center. We used to use the hybrid capture 2 for more than 20 years, and now we use the Abbott-Allington M test. We run for genotyping data the Inolipa HPV test for alpha HPVs, and we also use a multiplex PCR coupled to Luminex to study alpha, beta, and gamma HPV, and this is done in close collaboration with IRC. We have developed full-time PCR, especially for vaccine HPV, and we developed droplet digital PCR, which is a new PCR technique, which is very sensitive to analyze HPV in circulating DNA, for example, for the follow-up of patients with HPV-associated cancers. And we have conducted some studies with new generation sequencing. And in this task, we also give technical assistance for colleagues who run in their routine lab HPV testing. The second mission is counseling, education, and information for everyone who wants to be counsel educated or who wants an information. We work especially with our health institution in France, for example, the National Cancer Institute of Santé Publique France or the Ministry of Health. And the objective is to help these institutions to evaluate the public health policies they are introducing, for example, vaccination and screening. We have a mission of epidemiological surveillance, and I will give you some examples. And we conduct specific studies, which are coming from the National Reference Center. And of course, we conduct collaborative studies. The fourth mission is alert. When we perform surveillance, our expertise, if we see something wrong, for example, the emergence of a very infectious HPV, but it's not the case. So we have to alert the health authorities. No alerts since 5 years now. For surveillance, we have different projects, and we have to survey HPV in the general population as well as in vulnerable populations. Here, a study which is conducted in collaboration with Santé Publique France to study HPV in HIV-negative men who have sex with men. It takes part in another study called MEMO dépistage, and we take the advantage that these HIV-negative MSM undergo self-sampling in the oral cavity and at the anal level to study different STDs, and we analyze the presence of HPV. Here, the distribution in the anus, and here in the oral cavity. To study HPV in the general population, we recently published an interesting study that allows the long-term storage of cervical samples in FTA cards. This is a kind of like a small paper, and you put the sample on this card, and we have tested the stability of HPV and cellular DNA and proved that we can store these samples for 5 years at least. And it's a very interesting fact, because the cards are very small, and you can put it at room temperature. It does not necessitate refrigerators and so on. So it's quite easy. And we plan to use this mode of cervical sample storage to store samples from a cohort of vaccinated women with the help of Jean-Jacques Baldauf in Alsace. We are now participating on a survey on sexuality in France. This is a very large study conducted by the INSERM, Santé Publique France, and our colleague from the National Reference Center for STDs. And we had a specific study on young people in male and female, and we expect to include 3,000 participants and use vaginal and penile self-sample to study HPV prevalence in the general population. So we will study genotype distribution, and the study is planned for 2022. It has been delayed because of the COVID crisis. And also, we conduct studies on vaccine efficacy. This is one of our tasks. We have an ongoing study, which is called IMPACT study, and we analyzed HPV distribution in high-grade lesions in non-vaccinated women and in potentially vaccinated women, because we don't have the clear indication of vaccination in France. So we just took high-grade lesions in young women that potentially has been vaccinated, and we will compare the HPV distribution to women with a high-grade lesion who are older and which are not vaccinated. And the results are currently being analyzed. We also conduct a study with our colleague from the National Reference of STD and the Centre de Recherche en Épidémiologie, Santé des Populations. And we take advantage of a cohort that has been recruited for the analysis of chlamydia trachomatis on self-samples. And again, we will study HPV distribution. And now we have the information about HPV vaccination. And we know that approximately half of these young women, they are aged 18 to 24 years, are vaccinated. So we will be able to evaluate the vaccine efficacy in France. And last but not least, we plan to conduct a study in French Guiana. We plan to study the prevalence of HPV in high-grade lesion and cervical cancer to define HPV genotype distribution. And this is important since a school-based program of vaccination, and this will be discussed this afternoon, is going to be introduced. And this study will give a picture of HPV circulation in this high-grade lesion before school-based vaccination would be introduced. Okay, thank you very much for your attention.